All right, all set.
All right, great. I'm gonna just try to get it going for my phone as well.
All right, all set.
And okay. Welcome, everyone. Thank you for joining us for the first COVID-19 briefing of 2021. And I actually want to start on another topic. I want to begin today by recognizing that at this very moment, a joint session of Congress is certifying the results of the 2020 presidential election. At the same time, votes are still being counted in Georgia to determine the winner of the second Senate runoff race there. Meanwhile, Reverend Warnock has been declared the winner in Georgia's first Senate runoff race, making him the state's first Black senator-elect. This is a momentous day for our country and our democracy. It is a day that makes me feel hopeful about the future of this country. It's also a day that has major implications at the local level. A Democratic Senate, which seems likely at this point, could provide policy change and relief that municipalities, including Burlington, very much need for everything from the economic impact of the pandemic to reinvestment in our infrastructure to climate policy. I believe that the best way through the rest of this pandemic and out of this deep recession is to give local governments the resources they need to lead that work, to lead the public health response and to lead the recovery. I'm going to continue to advocate for that for Burlington in this process. The results that we seem headed for in Georgia give me considerable hope that there will be better decisions made in Washington about supporting local governments than have been made throughout this pandemic up until now. So with that, let's now jump to our COVID briefing for today, where as much as I am hopeful about those other topics and as much as I'm hopeful about the pandemic, we clearly have tough months ahead of us, maybe the toughest months of the pandemic. And we're going to talk about that with Dr. Loeffler. Thank you. Welcome back, Dr. Loeffler. I want to start today by talking about the new variant of COVID-19. This is a graph that I think everyone needs to see. Even as we are seeing the vaccine start to roll out around the world and locally, and we'll talk more about that later because UVMC, Dr. Loeffler's organization, is playing a big role in that. Even as that is beginning, and there's so much hope with that, we are confronted with a new challenge here. There is still early. We are still figuring out the science on this, but it does appear that the virus that we have been living with for 10 months now, and which I think we're all tired of dealing with, has mutated and has shifted. And there's a new variant that appears to be far more contagious than the prior variant, and which there are some serious implications for. That's what this graph is showing. Basically, if you look at the red line, which is Britain and South Africa, those two countries, there has been significant amounts of this new variant of the virus identified, confirmed, whereas that has not spread yet in the same amount to nearby European or nearby African countries. And you can see there's a very different experience that these countries that are dealing with the new variant are experiencing. They are seeing dramatically increasing, exponentially increasing infection rates. And there's something else going on. We can't definitively say that this is all being driven by the new variants, but there are no other obvious explanations for the contrast in those experiences. We know that although we have, I don't believe, I have not yet heard, maybe Dr. Leffler, I don't know if something has shifted today, but I don't believe we have identified a case, a COVID case where the new variant has been confirmed here in Vermont yet. However, we know that it is very nearby. Saratoga Springs, New York had a confirmed positive of the new variant, and it is very likely that the new strain is already starting to circulate in Vermont, or if not, is extremely likely to do so soon. So what does this mean for us? That's what we're going to talk about today. From my perspective, and in a moment, I want to turn this over to Dr. Leffler and have him give his expert opinion. But from my perspective, it means that it is even more critical than it already was that we redouble our efforts to contain the virus. We know that help is coming. Life-saving vaccinations are starting to be deployed, but the end of the pandemic is in sight. So we now, unlike earlier when we didn't know when this was going to end, it's clear we have the potential to truly prevent deaths just by stopping infections for a few more months, not just to delay them, but we have to stay vigilant to do that. So I'm going to be announcing today several immediate actions that the city is taking to slow the spread of the virus. And I am also asking all of you to recommit yourselves to all the practices that we've learned in the past 10 months that slow the spread of the virus. Avoid the 3 C's: crowds, close contacts, and closed in, by which we mean really indoor spaces, especially in combination of those factors. Wear your mask. Wear a good mask if you can, and we're going to talk about that later. Physically distance yourself when you are around others. Avoid non-essential travel and indoor gatherings with other households. Screen yourself for symptoms before entering the workplace or other institutions. And if you do think there's a chance you've been exposed, please get yourself tested. And we'll talk also about where we stand with those resources in the community. There's some news to share there, some positive news there. So with that, Dr. Leffler, I felt so fortunate from going all the way back to February when we first started talking about this approaching virus. What are your thoughts on this new strain and where we stand as we start 2021?
Thanks, Moreau. The first thing to understand is it's not surprising that the virus has mutated. There's millions and millions and millions of cases across the world. And any pandemic that there's ever been, and even in the normal flu seasons, over time, the viruses mutate. And some of the strains mutate and become less virulent or have different things. We now have a COVID virus that is more transmissible. They believe that our scientists believe that the reason that is that on the spike protein of the virus, it's now able to better replicate when it gets inside someone. And so when a person who has COVID coughs, sneezes, talks loud, they're actually putting out more virus than the normal version. So there's more virus in the air, which makes it more contagious, more likely to catch it. So the 3 C's you just talked about become even more important, because now if you're in a building where someone has COVID, let's say before, if they were coughed and 10,000 COVID virus parts came out, it might now be much more than that. So you're high risk for catching COVID. The good news so far is all evidence shows so far that the vaccine is still effective against the new strain. We don't know that for certain yet, but there's testing ongoing, and our ID experts and everything I've read so far says there's reason to be very optimistic that the vaccine will still be highly effective. And once again, we do from the flu vaccine. Some years the flu vaccine isn't a great match for the flu that emerges that year, but we do know that people who get vaccinated, even when it's not a great match, suffer less serious illness, so they still get sick, end up in the hospital less, and die less. So I still am 100% all in on the vaccine, and we have to get all the Vermonters vaccinated as quickly as we can. I was talking to you yesterday, and I kind of think about this now. This new strain, we should assume it's already in Vermont. If it's in Saratoga Springs, New York, we should assume it's here. And if it's in Vermont, it's likely to be in a county. If it's in Chittenden County, it's likely to be in Burlington. So that's the way I think about things. I would think Burlingtonians should be not surprised if the next 5 or 10 days we come out and say, yes, we proved there's a new strain here.
How will that happen, Dr. Leffer? Can you speak to that? Every time there is a positive, does he somehow get filtered through?
There's a certain small percentage of COVID virus infections that get fully gene sequenced.
I see.
It's somewhat random. So, but they're ramping it up right now because they want to know where this new strain is at. So some of the strains that we catch positive do naturally get tested further, and then we'll know if it's a different strain that's here.
That's interesting.
So that's how it happens. And so I really believe Vermonters should think it's here now. And the three, doing the right stuff, wearing a mask, wearing a good mask, washing your hands, physically distancing from others, being smart, the things that have kept us safe to now, it's time to really do those well. To your point, there is an end in sight. It's not tomorrow, but there's an end in sight. By next week, we'll have vaccinated the healthcare team at the hospital. We're doing a good job so far on our community providers. We're working through that. They're probably 3 or 4 more weeks out on that at the most. And then we're ready to shift focus. And then we're ready to start doing our community. That's not very far in the future. So it really is the time.
Is that what you just said?
Yeah. I mean, we're working hard with the state right now. And the hardest part of this at this point is knowing how much vaccine is coming each week. So we work with the state, but we don't actually know at the hospital how many doses we're going to get for next Monday. And so when we want to really ramp it up to do the state of Vermont, it's very difficult to schedule big clinics if you don't know how much vaccine you're going to have or when it's going to come. But it is getting better. The partnership with the state is extremely strong. We talk on almost a daily basis about this, and we are talking about how to be as quick, efficient, as safe as possible to get Vermonters vaccinated. So I'm confident that when it's here and in the amount that we need, we will move through it as quickly as we can.
What's the morale like up at the hospital with the increasing number of your employees getting vaccinated? Is there nervousness about the vaccine, or are people excited about it? How could you characterize that?
In general, people are extremely excited about the vaccine, and it's actually fun to hang out at the vaccine clinic for a little while because people are so positive, because this is, basically will end this pandemic. And people getting the vaccine know that every person in Vermont who gets vaccinated is one step closer to having Vermont be COVID-19 free. I will balance that with we do have more COVID patients in the hospital right now. So today we have 13 COVID patients in the hospital. We do have 3 in our ICU. That's more than we've had recently. We do have good capacity. We're not in a tight spot right now like many other places in the country, but we have more COVID patients that need to be in the hospital. So, and we are seeing more cases in Vermont. You look at over the past weeks, most days we've had 100 cases, or, there was 106 today, 166 yesterday. So more Vermonters right now are contracting COVID. COVID is here. So I kind of feel like we're in this race between getting people vaccinated as quickly as we can and keeping people safe until we can get them vaccinated as the new strain shows up, a more contagious version. So I would say at the hospital, people are excited to be getting vaccinated. They're even more excited to start vaccinating their community. People are sending me emails every day about, wanting to be part of that process, because once again, we know that's how we get back to normal. And the sooner we get that going, the sooner we can get back to the things that we really love.
Just so people have a little bit of understanding of the effort that's going to need to be involved in the rollout of this vaccine. Can you talk about just that one detail that seems really unusual? And I don't know if there's any you can explain why that the refrigeration or the freezing really needs to take place, not just, as I understand it, these vaccine capsules, they don't just need to be frozen, they need to be deep frozen. And why is that? And how is that does that complicate the logistics of deploying it?
The vaccines that we're giving right now, there's 2 vaccines we're giving to everyone right now. One is a Pfizer vaccine, one is a Moderna vaccine. And they're both what are called mRNA vaccines. They work in a little bit different way than vaccines in the past. The carrier, what we put the vaccine inside of, is lipids. And the lipids have to be frozen, very, very frozen to a very low temperature to basically not let them spoil. This is different than the vaccines we've gotten for the flu and stuff. And so it's very important that we keep them at that very precise temperature so they don't spoil. And it does make it more difficult because once you do thaw the vaccine out, you have a certain number of hours to administer it before there's a risk of it not being as efficacious. So you have to be very thoughtful about how many people are going to show up, how many doses you get ready. I mean, at the medical center, we've been 100% committed to not wasting a single dose, making sure that every dose that we thaw out goes into an arm. And we're lucky, we're big. So if we end up at the end of the day with a dose or two extra, we can find staff that were maybe scheduled for tomorrow or Monday. But in the communities, we're going to have to be thoughtful and careful about that. So we make sure that we use our doses as efficiently as possible. It's very likely that sometime this spring, other vaccines like AstraZeneca will be approved. And they're more of the flu type carrier that we've used in the past when you get your flu shot. And they may be easier logistically to administer. So there may be more options as the spring goes on. But the doses right now, the vaccine that people will be getting in the next month, let's say, in our community, will be one of these mRNA vaccines, which will have to be handled carefully and thoughtfully to make sure that it's fully efficacious when people get it.
Dr. Leffler, I'm going to let you go in a sec here. Just before we do, since kind of the theme of the day that I really, we're going to work hard to push to get this out. I think there's been some confusing public health discussion out there. I think a lot of people, it seems people, let's actually just talk about this a moment more. The people repeat this refrain, which is true as far as we know, and I think we said it already here, that there's no reason to believe at this point that that this strain is any more serious or deadly to the individual that gets it. And that's reassuring when you hear that. And it should be reassuring to any individual. You know, we're going to continue to have some people who get infected, and people should continue to know that, you know, a very small percentage, especially of healthy people that don't have some of these underlying chronic conditions, very low percentage of people will die. Yet the implications for the community are very different than that. And I don't think this is well understood. Can you, I mean, this graph we're still looking at sort of brings it home, but in some ways, the fact that the infectiousness level has gone up is more of a problem than that the mortality rates, than if there had been a comparable increase in mortality. Can you speak to that a little further? I thought the way I've heard you speak about this is very compelling.
Yeah, so from a population perspective, being more contagious is actually the bigger problem. So if any one of us that are on this call right now are unlucky enough to get the new version, it's no more deadly to us than the previous one. That seems to be very likely it's about the same level of lethality as the previous COVID-19. But the old version, let's just say that you infect only 2 other people. The chances are both those 2 people will recover as well. Let's just say the new version, you infect 10 other people. One of those people could actually end up dying, right? So that's the problem. If you're infecting way more people with something that has the same risk of dying, and you infect enough people, one of those people will die. So it's basically a small number, even a small percentage of a big number. If the big number gets bigger, you start adding on to the risk. The way I would think about this new version is that if you get it, for you yourself, it's not a big deal, but the 10 people you spread it to, one of them could really have a problem.
And each of those 10 are
exactly
likely to spread it to another 10. And that's why you get that line, like you see there with Britain, where this kind of change, it's the compounding of increased infectiousness day after day, patient after patient, can really dramatically change the number of people who ultimately end up having very serious or deadly illnesses. So that's why we're saying this is so important. That's why we're asking people to redouble their efforts to keep the virus from spreading. We have every reason to believe that the strategies that have worked in the past are going to continue to work. But, and in a way, it's a little bit frustrating because Vermonters have done such a good job. They have been working so hard for so long to contain the virus. in some ways, we're just saying, keep doing the same thing. Don't let down your guard. There are a couple areas, and this is the last thing I'm going to ask you, and we'll let you go, Dr. Leffler. We know Vermonters have done an outstanding job of wearing masks. One thing we're going to talk about today is something that hasn't had much discussion, but it is starting to get attention at the national level. My understanding is the CDC is starting, considering coming out with new standards about differences in masks. They haven't done that yet, but there's every reason to believe, from my perspective, that what kind of mask you wear, can make a difference. That all masks are not created equal. Do you agree with that? And do you have any recommendations on that, Dr. Leffler?
Well, we know in the hospital, we use different kinds of masks for different kinds of patient exposures, and we've done that for many years. And there's every reason to believe that for COVID, certain masks will prevent the spread and prevent you from catching it better than others. But I want to make sure that everyone on this call today understands any mask is better than none. So if you have nothing, wear whatever you've got, that's better than none. But I do think it's likely in the next 4 or 5 weeks, the CDC may come out and say, we think this mask is a little bit better for public safety than others. We know the double ply masks, the 2 layers, work a little better. We know that N95s, which had been hard to get but are easier to get now, provide a little more protection. So that's not surprising. But I don't want anyone listening to us to think, oh, if I don't have an N95 or 2-ply mask, it's not worth it, I should wear nothing. Any mask you wear, absolutely, we know it is better than no mask. But we do know that the really thin ones, the Learker ones, or I would say even more concerning is the people who wear their mask on their chin, not covering their mouth or their nose. You see, you can have the best mask in the world, but if it's on your neck, it's probably not preventing the spread of COVID.
All right, excellent. So any mask is far better than nothing. If you do have a choice between them, as many of us I think do at this point in the pandemic, we've all been sort of collecting masks. Yeah. Something like the city mask that we designed in consultation with the hospital back at the beginning of this, that does have a couple of layers, that does fit tightly around the nose and mouth. There's reason to believe that might do an even better job and do a better job in terms of protecting against the spread to others.
Yeah.
So, all right, with that, any final things you'd like to share, or should we let you get back to work?
I mean, I want to basically say the same thing I say every time. Vermonters, Burlingtonians, you're doing a good job. We still are keeping the disease burden in Vermont down. We still have hospital capacity. Vaccine is coming. It's close. Please don't give up and don't let down your guard, because we really could get through this in the not too distant future if we all just take good care right now. So please keep up all the great things you're doing, and thank you.
Thank you, Dr. Leffler. We look forward to having you back again soon. Maybe we'll talk more about vaccine implementation next time as that mass scale gets closer. And thank you for what you're doing. It's I find it incredibly hopeful seeing the social media pictures of UVMC doctors getting vaccinated, nurses. It really feels like we're going to beat this thing, and the end is coming.
We're going to beat it.
Thank you for everything you and your team are doing.
All right. Thanks, everyone.
Bye-bye. Okay. We're now joined by Brian Lowe, the city's Chief Innovation Officer. Brian, welcome back to the briefing. We're going to start by talking about testing. State Health Commissioner Dr. Mark Levine, at his briefing yesterday, asked any Vermonter who was in close contact with another household during the holidays, which was something that was a little more of it was allowed during that period there. The state is now encouraging everyone to get tested, which, if everyone follows that advice, that puts a lot of pressure on the testing system. But there's some good news about that. The testing system is getting stronger and stronger. Brian, do you want to walk us through the latest with respect to what I think is a really positive announcement? Maybe I'll just say it. I thought it was great to see this news that the 405 Pine Street site in Burlington, which was one people who watch these briefings may remember, we actually had a briefing down in front of the new site on 405 Pine Street, which is the Burlington City Arts Building. Something Brian Lowe and his colleagues hustled to get stood up very quickly. At the beginning, that facility was only able to offer about 250 tests a day. We said at the time we were hopeful that number would be driven up as things got more efficient and as additional, just as we got, I think, more effective at using that space and improving the systems. Well, that's what's happened. We are now up to 450 tests a day at that site. And my understanding is there's a lot of utilization that is happening there. What can you add to that, Brian?
I mean, I think that's a great summary, Mayor. I think there's still obviously, needs for testing in the community, but the fact that the state, the Garnet Health and CIC have been able to kind of help ramp up the volume of testing there is really important. The state is also bringing online some new testing, I believe once a week in Colchester, to supplement some of the testing they're doing in Williston, kind of in our general area. And the city is continuing to push for additional testing. And so there is testing every Friday in the Old North End at 294 North Winooski Avenue from 9 to 3. Walk-ins are welcome at 294. So if you can register in advance, that's certainly preferable. But they have the capacity to take some walk-ins at that site as well.
So let's just say this again. I think this wasn't clear last time we had a briefing, and this is very positive news. All of this capacity in Burlington, Colchester, and Williston, this daily free public pop-up test sites this capacity is going to stay in place at least through the month of January. Good chance that'll be extended again, but this is going to stay there at this elevated availability level. In addition, Brian, are we confident this Friday, this is what we're saying, right? That every Friday in January, this additional walk-in site that is, really intended to help serve a part of the city that we know a disproportionate number of people do not have cars, and where having a place that can be walked to is important. That's going to be available every Friday.
That's correct, at least through January. It's possible that the National Guard and state will be able to extend it longer, but I don't know for sure what February holds yet.
And another thing, just to make sure the word gets out on this, we'll repeat it again. All of these sites, well, the Burlington sites at least, I guess I'm not certain about the non-Burlington sites, have interpreters that are there to help anyone who has a language access issue. Is that right, Brian?
That is correct. In the Old North End at 405 Pine Street, and also at the O'Brien Center in Winooski, which is another daily test site, there is interpretation service available in many languages, thanks to AALV and USCRI Vermont.
All right, great. Let's keep going. Next, we wanted to give a further update on wastewater monitoring. This is really something, Brian, you and your team and the water services team have been working hard on since August. What's the latest?
So you can see from the graph here that thus far readings are holding broadly stable across the city. What we have noticed, though, is that as we drill into specific neighborhoods, there's a lot of volatility on the eastern side of the city, which could be an indicator of some coming growth. And also the Old North End of the city is seeing slightly higher levels than other areas of the city. So while it's good to see some stability overall, I think that there are certainly some indications of increasing prevalence in the community, but no immediate indications of exponential growth that we've seen so far.
Good. Given the everything we've been talking about, that we need to stay vigilant for some number of months now, given that there appears to be this new threat from the mutated virus, I've asked Brian to review all the city services and really do an evaluation of whether we should resume suspension of some in-person services. We'll have an update on that review in the coming days. There's a couple more updates that we'd like to give about local updates. So it's time, as we were speaking with Dr. Leffler, we are recommending that people up their mask game. Again, I want to commend and acknowledge that Burlingtonians have been outstanding at wearing masks. The community has been united in this. There was support from the business community when the city put in place this statewide a mask ordinance as soon as we were able to. Back in, I believe, May was when we put the mask ordinance in place, and we just know that compliance rates have been extremely high. We know UVM students and Champlain students did a great job wearing masks. We think that's been a part of why the prevalence rate, the cumulative infection rate in Burlington has been so low. It's one of the lowest of any metropolitan areas in the country. And there's clearly the fact that Burlingtonians have been committed to masks and Vermonters have been committed to masks have been a big part of that. We do want to add to that conversation mask quality. Again, I think it'd be irresponsible not to point out some kind of mask. Anything covering your nose and mouth is better than nothing. There is a lot of reason to believe, however, that there is a difference, as Dr. Loeffler said, in the quality of the mask. So, Brian, you want to speak to the kind of what from your perspective makes for good mask quality? Sure.
There are a couple things to consider as you're, selecting what mask you're going to wear on a given day. I think that obviously you need a mask that's breathable, but you also need a mask that's tightly woven. And the way to think about that is when you hold it up, does light pass through it? And you don't want light passing through your mask. You want to make sure that it's well fitted to your face, obviously over your nose and chin. And you should think about the layers of the mask. Is it one layer of simple cotton, or are there two layers to these masks? There's plenty of indication that second layer and that tight weave in a mask makes a difference in protecting those around you and potentially also for you yourself. So as we're dealing with a much more infectious variant of the coronavirus, these kind of choices will matter and in aggregate can help us keep our community safe.
So, I do think these principles, you were aware, of these principles as you were finalizing the specs for the city's community mask program and working with everyone from medical center doctors to community sewers to design these masks that were distributed in May and June. They have that 2 layers. They are form fitted to fit tightly around the nose and mouth. It has that dense weave. I think I see what your point. I mean, you really don't see light passing through the mask in any way. This is the kind of mask that if you can, you should get your hands on. And what can we say about the availability of masks like these if you don't have one, Brian?
So the city gave out about 26,000 starting in March and through about May and June. We've continued to give out some. We're looking into potentially ordering a couple thousand additional masks of that kind of high quality as well, just to supplement what's already in circulation in the city. But as you and Dr. Loeffler mentioned earlier, 10 months into this, there are a lot of masks in the community already. And so I don't know that, a kind of full court press for 26,000 more makes sense. But I do think, you've directed us to look and see about acquiring a couple thousand more masks and whether or not that makes sense.
All right, very good. Brian, thank you for joining us. Why don't you stick around in case there's questions about any of this. Now I want to bring on our last partner here on the briefing today, and that is Kara Al-Nazraoui, who is both the director of the Church Street Marketplace and is leading our small business support efforts citywide through this pandemic, and has been done a great job at that. Feel so fortunate that Kara joined us just not too long before this pandemic began. And how are you, Kara? Thank you for being back on the briefing with us.
Hi, thanks. Thanks for having me back. I'm doing well. Do you want to launch the ventilation discussion? I'm happy to hop in.
Well, we've talked about ventilation numerous times in the past on these briefings. And we've often shown this Burlington City Arts created graphic, which we basically stole from think Sweden showed it first, and it's actually a graphic that started to get quite a lot of attention. The New York Times had it on the front page of their home site in the last few weeks here. And it takes a little interpretation, the idea of a Swiss cheese defense, which the suggestion is, the implication of this is that none of our defenses against the virus are perfect, but if you layer them on top of each other, it is very hard for the virus to get through all the different layers, and we can stay safe if we deploy these different techniques. One of the important strategies is good ventilation. I mean, essentially being outdoors is the best ventilation, and that's why we've encouraged that so much. But even in indoor spaces, it really matters the type of ventilation that is present if you have people from multiple households there. Good ventilation can be the difference between an infection happening and not. And we've been doing what we can to bring attention to this and to help nonprofits and businesses who do have in-person services, help them improve their ventilation. We have another announcement on that today. Why don't you take it from here, Cara, about kind of what we've done so far and where we go next?
Yeah, so as you know, we did previously launch a matching microgrant program, and this program that I'm about to describe is well, here, I'll hit this point that Olivia has up. Since mid-October, we have had several initiatives, and keeping proper ventilation in areas where there's mixed households is become a priority. And Mayor, as you mentioned, we kind of need to move quickly because there is most likely, as Dr. Leffler said, this new strain, or we should assume it's in our community. So we're looking to move forward quickly and set up a new program. This program will be fully funded by the city. And we're looking, again, I can't stress enough how quickly we're looking to move with this. So how it's going to operate is the city is going to purchase these HEPA filters, and they're standalone units, and they filter the air in the room, and they have been tested and proven to filter out the virus, not 100%, but again, going back to your Swiss cheese method, it's helping to alleviate some of the problem. So again, we're looking to take $25,000 of emergency funds. I think our first round, we're going to take $5,000 and make a large investment in units and see what the demand is. We are looking to set this up on the RRC website starting Monday, so that's the 11th, and having a 1-week application period. So it's not a first come, first serve, but we are encouraging people to move quickly so that we can assess their needs and get these units out there as soon as possible. What's going to be new about this is there will be a question on the application, not only about the size of the space you're trying to treat, but on average, how many members of the public are in this space. And that will play an important role in the distribution of these units, mostly because we want to have the largest health impact on the community possible. So if you have a place where there's 100 people in there every day throughout the day, we're going to want to make sure that we're cleaning that air. So we're urging people to come back to the RRC website page on Monday, and we'll have that application up and running. Once the units are purchased and we've decided the need, we will set up some sort of distribution process with city staff to get these units out as soon as possible.
Great, thank you. It's a great summary. We know that dozens of organizations took advantage of the earlier version of this,
Yes.
The prior program. We know that there's a need and interest in trying to help with, public health in this way. And at the same time, we're in the middle of a deep recession where many businesses can't afford any kind of expense. And we know that there are places around the community that the public is going into that don't have this additional layer of protection. We're going to try to help put it in place. So we're moving to it kind of in parallel. We are purchasing these, at least the initial batch of these additional filters now.
Yep.
This very focused application process starting next Monday, open for a week. So it will, we have to move quickly here. So it'll only be open for a week. It will not, however, have the unfairness of a kind of first come, first serve program. We're going to try to make a quick judgment about where these filters can have the biggest impact here in Burlington and deploy the filters to those places. So again, come back to the RRC, the Resource and Recovery Center homepage, which you can get to in one click from the city's homepage, burlingtonbt.gov, and this application will be up on Monday, and we'll send out other communications reminding folks of that. But I want to share that with you now, and that is what we have for a briefing. Thank you for coming on, Cara. And
Great, thank you.
Olivia, why don't you stick around, Cara, in case there are questions. Do we have any questions, Olivia?
We do. First up is Jolie from 2244. Jolie, you should be able to enable your microphone now.
Welcome, Jolie.
Oh, thank you so much. Can you hear me okay?
Yes, we can hear you just fine. Go ahead.
Great. I wanted to know, I know Dr. Leffler left, but I wanted to ask you, I know it was mentioned a few weeks ago, you had plans to get vaccinated, but weren't in line, like the first to be in line. But I was wondering, do you know of a rough timeline of when you'll be vaccinated?
When I personally are going to be vaccinated, I plan to go when we get to the point where individuals of my age group and risk profile go. I think it's really critical right now that every dose go to the people most at risk, which are people in our long-term care facilities and our healthcare workers. And my understanding of the decision that the state has made is that from that point, then they are going to find a way to prioritize people by age and chronic health condition, which that group clearly has the highest risk in this pandemic. And I wouldn't want to take a dose away from someone in the higher risk category. So my plan is to, like all of us, wait our turn, follow the, trust in the system. We're engaged and talking regularly with Dr. Levine and Dr. Leffler to make sure we can do anything we can as a city government to help with that system. If their final decisions are being made, as you heard, we're some weeks away from the kind of widespread deployment of this vaccine to average Vermonters. When that happens, there's going to need to be, I think this isn't going to be like the flu shot because of the special logistics involved, as Dr. Leffler was discussing. I think we're looking at having large scale sites that can process many people quickly outdoors, and we are in close contact with the other authorities to look at whether any kind of site in Burlington is going to make sense, and if so, anything we can do to help the Department of Health and help UVMC in getting those sites open, we'll do.
And do you know where first responders, such as Burlington firefighters and policemen and women, where they fit into getting vaccinated?
Yes, the firefighters were considered part of the kind of medical staff because our firefighters are EMTs and they are transporting patients who may be infected with the virus. They were considered healthcare workers, and they, at this point, I believe, we are getting close to. It's been staggered. There's been an intentional spreading out that everyone isn't getting vaccinated at once because many people, the nature of this vaccination is that a lot of people don't feel great for the next 24 hours or so after receiving the vaccine, and that's a good thing. In some ways, it's a sign that the vaccine is taking. But we didn't want to we wanted to spread out. So that not everyone was sort of under the weather at once. I think we're getting close to the end of that effort, and almost everyone has gotten their first dose. They are the only city workers who have been prioritized at this point.
Mm-hmm. And then I wanted to know, Do you have any insight into how pop-up sites will detect the new variant? Eventually if someone were to go to a pop-up site, will their test also be tested for the variant?
Yeah, Jolie. So actually, I didn't know the answer to that until the conversation. As I understand, Dr. Leffler, here's what happens. The point that Dr. Leffler made is that not every positive infection is tested for the kind of genetic makeup is examined. Most are not, but there is a public health protocol in place so that a small percentage of the positives do get that additional analysis, and that is being ramped up right now because people are looking more carefully. So a higher percentage of these samples is getting that additional level of analysis. But that's another reason why we are, a little bit in the dark here, a little bit similar to where we were at the early stages of this pandemic. It's not totally, we don't know with total precision exactly, when this new variant will get here, because it's not possible to do that kind of genetic testing on every positive test. So that will kind of contribute to perhaps a lag in when we know exactly when and how much of this new variant is circulating here. That's why we are encouraging everyone to assume that it is already here. It may well be. And if it's not here yet, it almost certainly will be soon. It's been detected in multiple states already. And there's every reason to think we'll get here soon if it's not here already. So people should be on guard and showing that extra vigilance now.
Could this potentially alter the 10 p.m. curfew that's set on many Burlington business like restaurants?
So, to their credit, the state and the Department of Health, which makes calls like that generally, although they have delegated some authority to the city, and we've used that at times, but generally the government agency that is leading those kind of determinations and shifts is the Department of Health, and it is the governor that really has the great majority of the authority to make changes like that. To their credit, they have really tried to ground their decisions in science, look very hard at the numbers, and only and not deploy interventions if they're not going to have an impact. And up until now, their determination has been that the regulations that exist and are in place for bars and restaurants are working, that we are not seeing significant numbers of new infections take place in those settings. But you're quite right. I mean, it is possible that what has been safe up until now could shift with this new variant. All of us will be watching that very closely.
Thank you so much, Mayor.
Okay. Thank you, Jolie. Thanks for all your questions. Good questions.
Next up is Seamus from VT Digger. Seamus, you should be able to enable your microphone now.
Great. How's it? Can you hear me okay?
I can. Yes. Welcome.
Perfect. Yeah. Thank you. So with this presence of the more contagious, strain of COVID, as we've talked about, if we're going to assume that it's already here, would that change what you'd like to see out of the priorities for the vaccine rollout? Changing maybe what types of people, making it more open, just to get more as many of the vaccine doses out as quickly as possible.
So, Seamus, I certainly had questions when I heard about this prioritization that after the long-term care facilities and the healthcare workers are treated, that from that point it is only going to be driven by age and chronic conditions. And I guess I still have some questions. I generally speak to Dr. Levine every Thursday afternoon, and I do plan on asking some further questions about this. At that, and and there still is a little time again before, as Dr. Leffler mentioned earlier, before there is going to be sort of widespread vaccination happening to the general public. That said, I have an appreciation for the way in which the state is thinking about this. They have a lot to factor in here in terms of, we're talking about a logistic effort unlike anything that modern America has encountered. And there, as we have started to see in other parts of the country already, there are a lot of ways that things can go wrong. There is a risk of wasting these precious vaccines. They can only be unrefrigerated or unfrozen for 12 hours before they're spoiled. You got to make sure, you got to find a way to match the number of people arriving. Has to match the amount of vaccine available, and there's got to be the staff there to make it all work. So given that, and given that the risks, as I understand it, overwhelmingly seem to track with age and chronic health condition, it's not universal. Young, healthy people are at risk and do occasionally die, but we know that really age plays an enormous role, as does existing health condition. Given that, and given the need to keep this simple as possible, I see some wisdom in the way the state has decided to do this. I know they have sort of details still to iron out, and I have some questions, and we'll be engaging in those details, but I'm directionally supportive given what I've heard so far, and given my understanding of the thinking behind why they have chosen this straightforward methodology.
And Dr. Leffler, when he was on, seemed to underscore the efforts that Burlingtonians have been putting into, keeping infections down and hospital beds open. Do you have any immediate concern over this more contagious strain of the vaccine filling up those beds? Or do you have more confidence in this bend, don't break sort of defense and the effort that citizens have been doing to stop that from happening?
I have great confidence in Burlingtonians and Vermonters. It is amazing what the people of this state have done. Just every day I look at the COVID Act Now website, and we're the only, again, today, I believe, almost every day, we're the only state in the continental United States that is not red, meaning that, we're the only one not in an active outbreak or at risk for an outbreak, the way those data scientists define it. And that's been consistent since the beginning of this pandemic. The experience in Vermont and the experience in Burlington has been without parallel in this country. There is the lowest level of cumulative infections of any state, and Burlington, it's one of the lowest levels of cumulative infections of any metropolitan area in the country. And at the end of the day, that is 100% about the actions that Vermonters had taken. So I have we're 10 months into this, and it's, maybe it seemed a little fluky at first, but now we've been doing it for 10 months and we've been bucking all of these different trends. Other towns that had colleges, other cities that had colleges saw a big spike when the students came back. We didn't. On time and again, we've had a different experience here in Vermont. I fully expect that's going to happen again. I do think, though, we got to talk about it, and we got to all understand the importance of staying vigilant. We have seen how quickly circumstances can change, even here in Vermont. And the foe, our enemy here, has shifted, and it has sort of new tools that we have to be aware of, just at a time when I think a lot of people are pretty sick and tired of this. So I do have full faith in folks, but it isn't just going to happen. And we all need to, again, that's why I'm asking people to recommit themselves to this right now. I find it so poignant, Seamus, that, and I've seen this now, a number of other people make it. It's just, we are now at the stage where we really preventing deaths is really now possible. Every new infection, every new death is at some level preventable now in a way that it wasn't at earlier stages. And I just hope everyone can hold on to the importance of their actions for a little bit longer here.
Great. Thanks a lot.
Thank you.
The last question is from Lauren from NBC5. Lauren, you should be able to enable your microphone now.
Hi, Mayor Weinberger.
Hi, Lauren.
So thank you. This is actually a completely off-topic question. I'm sorry. But I wanted to know what your thoughts were on the BIPOC grant program now that the recipients have been selected.
Well, I think this is a great program and meets a really important need. And the feedback that we have gotten from recipients of the grants has been very powerful. Some of the testimonials I've read have been heartwarming. We're not talking about large amounts of money here. The grants were $2,000 to $7,000, but they seem to have had a huge impact on the trajectory of a number of our BIPOC-owned businesses, and maybe the difference between an organization staying in business and needing to kind of fold its tents. We know that BIPOC individuals have been disproportionately impacted by this pandemic in so many ways. First of all, it's stunning, the disparities, the racial disparities that Black and Hispanic Americans have endured in this pandemic, the higher levels of infections and even higher levels of disparities in death rates. And we also know at the same time that the relief efforts, the economic relief efforts, which were set up by the federal government in many cases to be kind of first come, first serve type of programs that advantaged dramatically businesses that had banking relationships already, which many of our startup BIPOC-owned businesses, immigrant-owned businesses, many of them don't have those kind of relationships with financial institutions. So that's been a further injustice and unfairness about how this pandemic has rolled out. So I think it's you asked me how I think it's great that Taisha Green, our Director of Racial Equity, Inclusion, and Belonging, was able to work with so many major companies in the area and secure these philanthropic grants to the city so that we could add on top of our other relief efforts and put these dollars out in this way. I think it's been one of the best innovations of this pandemic.
Thank you so much.
Okay, thank you, Lauren.
And that's all we have for today.
Okay, thank you everyone for joining us, and thank you again to Cara, Brian, Dr. Leffler. We will certainly plan to be back again next Wednesday, although, as is always the nature of the pandemic, if there are developments before then, you may hear from us sooner. So thank you, everyone. Stay safe out there, and we'll talk to you all again soon.